Welcome back. Dr. Savek Tamorian is here today. We call him Dr. T.
Yes, how are you doing? Good to see you again.
Nice to see you. And Harvard Eye Associates, of course. Just a wonderful group of doctors over there. We did a segment over there, as you know, a while back, and we have Dr. Hofanesian on. You guys do a lot of great work. You're really kind of on the forefront of eye care. Orange County in general is.
Thank you, yes. Yeah, we actually are in a very good position, and we're very fortunate to be such a large group, able to take care of almost all ocular diseases.
Yeah, very good. Well, today we're going to be talking about glaucoma, and this is something that I think over the years there's been a lot of advancements in treating it. It seems to me many years ago, I forget how many years ago it was, I remember there was some actor on a TV show and talked about getting, in fact, they wrote it into his character.
Yeah.
And I want to say it was Knight Rider or something like that, but it was at the time, I remember hearing about it, it was almost like you're doomed.
Yeah.
And there's been some great advancements, haven't there?
Yeah, there's been significant improvement, not just in the way we treat people with glaucoma, but how we diagnose people with glaucoma. And probably the most important thing when it comes to glaucoma treatment is being diagnosed early in the spectrum of disease. That way treatment is easy and people preserve their good vision. The difficulty with glaucoma truly is the stealer of vision, but it does it so very silently because people don't notice they're losing their vision because it's their peripheral vision. Once they've lost enough peripheral vision, then they're having issues. At that point, it's already advanced glaucoma. So not only is the person having advanced field loss, it's also very hard to treat. So you want to catch it early if you can.
Is just as we age, actually this is kind of a double question here. Is it a disease that as we age, it's versus someone who's young? And then the other part is, you mentioned peripheral vision. Is it just in general, as you know, our eyes weaken as we get older, so is it normal to lose some peripheral vision?
That's a great two sets of questions here. It is more common as you get older to develop glaucoma, but glaucoma isn't just one disease. It's actually over 40 diseases put together.
Oh,
the end pathway is all the same. That's when the pressure of the eye or the intraocular pressure is high and it damages the nerve, and that's what eventually leads to the loss of vision there. Now, as you get older, very normal to lose some of those nerve fibers of the optic nerve, which is that sensitive cable that connects information from your eye to the brain.
Got this on a screen here. Yeah.
Yeah, but it's not normal to lose too many of it.
Okay.
What this diagram up here shows is people who have glaucoma generally will lose their peripheral vision first. So they don't even notice that they're losing it because the most important part of your vision is in the center. That's what you do when you're looking at something. Until it's so extreme that they start bumping into things and they're noticing the vision isn't good. Unfortunately, that's the time when people show up to the office, but that's already advanced glaucoma. And that's really hard to treat, and we've already lost a lot of ground. If we can somehow catch it earlier in the disease process, get it under control, then it's never an issue of having to lose the vision.
So what are the treatments? And the first part, I guess the question I should be asking is, regular eye exams, right? This is gonna show up.
Exactly. As part of a regular eye exam, we actually get to look at one of the most important things. That's the back part of the eye, the nerve. And I'm not sure if you and our viewers at home notice, but the eye and the optic nerve and the blood vessels that supply it is really the only place in the body we can really see the tissue. You can actually see the blood vessels when we examine it. So our entire ocular exam focuses on examination of that nerve. And that nerve appearance, the way I describe it to my patients is, think of that optic nerve like a donut with a donut hole. And that donut is that tissue that's letting you see. For people who have glaucoma, their eye pressure is high. It damages that nerve. The donut hole gets bigger.
Okay.
Like someone's eating away at the donut, but in this case, it's the glaucoma that's eating away at that nerve. You lose enough of that donut or that nerve tissue, then there's parts in your vision you start to miss. So our entire focus of our eye exam, and there's multiple layers of what we do, is to take a careful look at that optic nerve.
You just mentioned the pressure increases. Is somebody going to feel that?
Generally not.
Okay.
A few types of glaucoma, the eye pressure can be very high, up to 60, 70 high. Then people do feel that. They generally feel nauseated.
Okay.
For most diseases in glaucoma, the pressure is just slightly elevated, and people don't notice that. But that slight elevation over a long period of time is what causes the damage.
So how does one get glaucoma? Is it hereditary? Is it just, the bad luck of the draw, so to speak?
A lot of things put together because, again, there's over 40 types of glaucoma. It depends. Most of it is related to genetics, but it doesn't have to be. There's people who get infections in the eye, inflammations in the eye, cancers of the eye, things that we normally can control that can develop glaucoma.
Okay.
The way I think about how it actually occurs is to think about the eye a lot like your sink at home. There's a faucet and there's a drain. The faucet is always on because there's always fluid being created in the eye, and the fluid is a needed component. That's what provides nourishment to the tissues inside of the eye.
Okay.
The fluid then needs to exit the eye through the drain. But in glaucoma, for one reason or the other, the drainage system is clogged, the water or the fluid builds up, and then that's what causes the damage to the nerve.
Okay, so it's caught early. What are the treatments and what is the long-term prognosis?
A lot of changes have occurred with glaucoma treatment. We used to only have really one drop and then advanced glaucoma surgery. Now we have a whole spectrum of treatment, which includes many different glaucoma eye drop options. There's also laser procedures that can be done and various surgical procedures that can be done too. It depends on where the patient is in terms of the spectrum of their disease and what particular type of glaucoma they have. Then we can tailor their treatments to their needs.
Okay, but it's if it's caught early, it's good prognosis. And there is a type of surgery, is that what you're showing here?
That's just one particular type of surgery that's known as a trabeculectomy, but there's various different types that can occur. And really it's a replumbing of the fluid within the eye.
Okay. And how do you prevent glaucoma? Is there a way to do it? Is it just, you folks, you and Dr. Hovannisian often talk about just the general way we need to care for our eyes. Does that help?
Yeah, it does. The most important part about prevention of glaucoma is early diagnosis.
Okay.
Because when you're having loss of that nerve tissue, it's permanent nerve loss. There's no way to recreate that donut again. We wish we could, but we can't. So we're left with the tissue that we have. The earlier we catch people in the disease process, the more of that donut tissue we can preserve, the better they do in the long run. So really early prevention, early treatment is generally the way to go.
All right.
And that's what the information we like to spread about today. This is January, it's Glaucoma Awareness Month. Most people, and this is a great slide up here, 4 million Americans, they never saw it coming. You don't notice you have it until it's too late. So the only way to prevent it is to be aware that it could exist, especially if you know about it in your family, and to get your eyes checked.
And you folks at Harvard Eye, you're doing kind of an open house, a seminar, am I right, at the end of the month?
Towards the end of the month, on the 29th, I'll be giving a free educational seminar to anyone in the community that wants to come out and hear a little bit more about it. You're more than welcome to come, whether you're one of our patients or an outside patient. We're just happy to be there to be able to spread the word. And
we'll update you on that. We might put it on our message board, so we'll make sure to get that information. They're close by here. They're right over by Laguna Hills Mall, so not difficult to get to. It's a wonderful facility.
Thank you.
Over there. As I said, just a great staff. Everyone that is there are just really not only just the level expertise. You're all just very nice people.
We're very,
you really are.
Very fortunate, very skilled people to be there, but we all have the primary goal in mind, that's taking care of our patients. And when we all think in the same way, we really have an opportunity to do some really good things there.
All right, it's great to see you.
Thank you so much.
And we'll see you again soon. Again, we'll tell you about that open house that they're doing as we get towards the end of the month, and we'll announce it. We'll have it on our message board. Dr. T, it's good to see you.
Thank you so much.
Happy New Year to you.
Happy New Year
to your
to
family.
everyone out there.
All right, we'll be right back.